All right. Hello, Dr. Miaken of Monarch Family Chiropractic. Welcome to our workshop tonight, Cause versus Effects-Centered Care. And I love this conversation because, especially when you are choosing a healthcare, I want you to understand the lens in which you're receiving care. Okay. So cause versus effects-centered care. First, here's my question for you. And although you may not be able to answer some of these, you probably have some ideas around what causes, say, low back pain. So let's start there. What causes low back pain? An injury, a physical injury, could be an immediate motor vehicle accident, acute, like one physical act that causes major low back pain. Or it could be the cumulative impact over time, that repetitive injury, that repetitive stress that causes low back pain, right? Is low back pain genetic? Yeah, I mean, I can see who's here and what they're doing. They're saying, no, it's not genetic. And I agree, there is no gene out there that says low back pain, right? So it is a lifestyle injury or lifestyle stress to low back. So let's just go with that one. When we're starting with cause versus effects-centered care, I want you to understand that the paradigm that we live in terms of our healthcare system is called pathogenesis. Pathogenesis is the birth or study of disease, what causes disease. And the goal in allopathic medicine, in a pathogenic model, is to get rid of the disease. Okay, so first of all, when we look at the list on this slide that says low back pain or arthritis or cardiovascular disease, cancer, obesity, diabetes, Alzheimer's, in the pathogenic model, in allopathic model, our healthcare system, they will look at this as a pathology. They will look at this as a diseased process. So number one, understand that when you walk into a doctor's office and you receive a diagnosis, they are diagnosing you with a lens of disease and pathology, with a primary objective to remove that disease or that pathology. So how do they do that? So in an effects-based care system, a symptom-based care system, in our allopathic pathogenic model, we start with a symptom. So let's go with low back pain. We have low back pain. It's across my low back. It's shooting down into my right glute and it's going all the way to the foot. Okay. A lot of people know this as sciatica. Okay, sciatica is the nerve, and it indicates that there is inflammation to that sciatic nerve, and that is where it travels. So you go to your doctor, and your doctor will take a case history, and they'll say, well, when did it start? How long has it been going on? What are the activities that make it better or make it worse? Describe the pain. Where does the pain go? They do their examination. And when it comes to low back pain, I will tell you that your chiropractic exam will far outweigh and trump any exam done in the medical world, period. I mean, just ask, or maybe you've experienced a medical doctor who will do a low back pain exam. They're not trained to palpate the spine in any depth or, skills in terms of hours and hours and hours of palpation and practice and understanding how those vertebrae should move. But they'll do an examination. They'll probably do some palpation, measure any temperature changes. They'll do some orthopedic exams to really pinpoint, what level is a sciatic pain coming from. They may do some motor or muscle testing, neurological testing in terms of your reflexes and sensory. Is it impacting the skin? Are you getting numbness and tingling? And then they'll come up with a diagnosis, and they'll say, you have sciatica. And they will say, what is a treatment for sciatica? And they will go to their toolbox, which for our pathogenic model is PT is there, which is great. And a lot of times it's prescription medication, pain medicines, anti-inflammatories, muscle relaxers. And that only helps for so long because what is it addressing? The symptoms. Let's talk about what an anti-inflammatory does. First of all, if you have low back pain, it's probably a pretty good indicator you have inflammation. Is the inflammation good or bad? Right, it's a signal. And I would argue that nothing in the body is done out of error. So I would say that inflammation is an indicator and a healthy response of an immune system to an area that is injured. It becomes a problem when the inflammation is chronic. It's lasting months, years, okay? So inflammation, you get an anti-inflammatory, that's going to, you take that anti-inflammatory and that's going to go in and it's going to take that inflammation out, period. It doesn't care why it's there. It's going to take it out. And guess what? Inflammation is really uncomfortable, right? You think about a swollen ankle, what happens? You get massive blood flow, it blows up like a balloon, and all of that stuff causes a lot of pain. So we think we need to get rid of this pain. Well, a part of that healing process is allowing that inflammation to do its thing. Okay, so number one, we're taking away the inflammation. Muscle relaxers. So why is the muscle rigid or contracted or spasmed in the first place? So let me just tell you, if you have a spine, let's say here's two vertebrae. Can you go grab me those vertebrae on my desk over there? Here's two vertebrae. Let's say they're rotated, okay? And you have these vertebrae along, it's right by that picture of Amanda. Thank you. The small one. You're the best. I'm going to use not my hands. I'm going to actually use it here. So I've got three lumbar vertebrae. And understand, you've got muscles that attach from vertebra to vertebra. Okay? Those muscles, teeny tiny muscles that attach from vertebra to vertebra are stabilizing muscles. Okay? They're there to stabilize and support a healthy, strong spine. But then you have global muscles that attach like globally from vertebra to massive other parts of the body. Like they go from here down to the iliac crest or the ilia, or they go from here all the way up to the scapula, or the traps, they go from your occiput down to shoulders, but there's also attachment points down to your lumbar spine. So you have these massive muscle groups that can be big muscles and smaller muscles that are impacted when you have, we'll call it a subluxation. So if you have a vertebra that's rotated through here, and automatically it's causing stress to this nerve here, and it's pinching that nerve, what happens? Your brain doesn't like that. So it's actually shortening fibers on one side, lengthening fibers on another. So you got muscle tone change. And then, you can't impact one thing without impacting the rest of the body. So you've got bone change, then it turns into muscular change, impacts nerve change, and that's there long enough, it becomes an inflammatory state. You start getting swelling. So we know that swelling is an immune response. So we take an anti-inflammatory that takes the swelling down. Okay. And now we're taking a muscle relaxer to relax this musculature that is tight and rigid. And I always ask, well, why is the muscle tight and rigid? There's a reason. Your body doesn't do anything in error. It is straining. It's protecting is really what it's doing. Your neuromuscular layer is going into a protection mode because it doesn't want any more movement by this structure to put more stress on a nerve system. Okay, so you take an anti-inflammatory, you feel better because it takes the inflammation away. Take the muscle relaxer because it starts to reduce the increased tone and rigidity within that area of the body. And let's see. And then you have the pain med. So anti-inflammatories, muscle relaxers, pain med, that just takes away the pain signaling at all. So you can start to see how this can be a big problem. When you take all that away, then you create an area that is susceptible to more and predisposed to more injury and problem. But you won't feel it because you're taking a pain medication. So this is where you start to see that it starts with symptom-based care to address the low back pain, but down the road, that doesn't work. Now we're going to go into cortisol injections, and we're going to inject in the area to take out that inflammation because it's just not going away. And then that doesn't work. And now we've got a bigger problem when we're talking about surgery. I mean, that is really the trajectory that we move into when we're talking about structure and low back pain. So in our pathogenic model, where we are just basing our symptoms, well, basing somebody's diagnosis off of a symptom and exam, we create a differential diagnosis. And from that differential diagnosis, we're going with what we think is the primary and giving appropriate treatment to that primary, which in our healthcare system is symptom-based only in prescription medications. Do you think that that is really ever going to address the problem? Just the symptoms. And so then you continue to go into the doctor, and it is a problem, and the exam findings start to show worse and worse symptoms and findings. And so we give you deeper and deeper, more aggressive treatments to address it. So I'm using low back pain as an example, but I will tell you, let's go back to this slide. Most people are dying of chronic disease, period. Heart disease, cancer, obesity, diabetes, these are chronic diseases. And I will ask you this, what is the cause of chronic disease? And the simple answer is your lifestyle. Your lifestyle is the result, or how you choose to live your life on a day in, day out basis, years on end, for decades, creates the perfect storm of a chronic disease diagnosis. Diabetes doesn't happen overnight. What causes diabetes? Right? It's, again, looking at diabetes, it's your blood sugar and your body no longer being able to manage the blood sugar on its own, doesn't respond to the insulin that your body is producing on its own. So our pathogenic model says, well, let's give them more insulin. You're not responding to your own body's insulin, so we're going to give you more synthetic from the outside in. Meanwhile, we're not addressing the lifestyle component of how we're moving and how we're eating, right? And we're continuing to gain weight, and adding weight to our structure puts more stress on our structure. So now we're starting to see, oh, I've got low back pain, and now I'm brain fogged, and I have low energy, and I can't think clearly, right? It's a problem. And so, again, our Western model of healthcare is really great for emergency situations, right? If you come home and your house is on fire, are you going to call the carpenter? Or are you going to call the firefighters? And what are the firefighters going to do? They're going to knock down that door. They're going to spray everything down. They are going to take care of that fire, and they don't care what happens to that house to do it, right? They don't care that, there's walls falling down and beams coming down, because their job is to take care of the fire. And what happens after you take care of the fire? You call the carpenter and the architect, and you say, I need to rebuild my home. And so right now, using that analogy, our healthcare system is the firefighters. And we're using the firefighters for a problem that is not a fire, but they don't care about how it impacts the structure of your home or your body. because they're getting rid of the alarm and the symptom, right? And so we really have a much bigger issue down the road. And that's why you have people dying of chronic disease, because it's real hard to make a lifestyle change. And a lot of people don't know any differently. So I ask you, what are the causes? And if you have any diagnosis from your doc, whether it's heart disease or diabetes or, I don't know, hypothyroidism or you know, PCOS or hormonal imbalances, I want you to sit with, well, what caused this? And when do I think it started? Because it's probably been going on for decades, years. And if you're just going to a facility that's going to address only the symptom, then you're not really getting true health care to infuse vitality and longevity and to really support a higher expression of health, right? I mean, it's great that somebody's coming in and they're like, I feel pretty dang good. Awesome. Well, we're thinking about what is 5-10 years from now, because I want you to be able to do this and more later on down the road, right? So, I mean, I just want you to see this here. And I know it's small on the screen, but our pathogenic model, their disease, the starting point is always the disease or the problem. And the goal, well, that third row down, the goal is to eliminate the risk factors. And you do that through, you know, preventing and getting early detection. But it's to treat a disease. And if they've prevented pain or loss, if they keep it from getting worse or they minimize the problem, then they feel like, okay, we've done pretty good. But the world that they live in is fear. Right? You're not going to the doctor and thinking, oh man, I got a diagnosis of heart disease. I feel pretty good about myself. I feel like I can attack this and get rid of this diagnosis. It's, well, I guess I'm going to be on these meds, right? And the outcome is really, if there is no problem, then they've done their job. And I want you to understand that when you are in a chiropractic model, it's called salutogenesis. It's the exact opposite of pathogenesis. It is the birth of health. What creates health? And if somebody's not healthy, then what's missing? That's what's keeping them from being and expressing health. Yeah, it's very different. So when the starting point for our, you know, allopathic model is disease and problem, we're looking at it, what's their potential in health? What's their health potential, right? It's a very different lens for somebody to render care. You know, the goal, maximize expression of health potential, create health factors, obtain health, promote gains and growth, improvement, optimize your potential, empower somebody to take responsibility to change. And it is something that happens over a lifetime. It is something we are continually working on. You know, somebody asked me, once I choose chiropractic, is there ever an ending point? There's always an ending point if you choose that. But know this, once you understand the importance of your spine, once you see you've got degenerative changes in your spine, you will need to take care of your spine, period. And you will choose to do that or not. But it's a choice. So it's, how do you choose to take care of your spine? How do you choose to take care of your health? Because your health, your health, it's going to be taken care of. It's just how is going to be taken care of. Is it one in a model that's just waiting for something to pop up? Or is it one in a model where you're intentional and you're empowered and you're taking responsibility, and it takes investment, it takes time, it takes money on the front end? But on the back end, That's where you hear that statement, an ounce of prevention is worth a pound of cure. Right? So anyway, know this alone. This is what I love, because if I ever have anything that's ailing me, number one, I don't want to be categorized or placed in a box. I don't want somebody limiting my potential. And number two, I want to work with a healthcare provider who's not going to just look at the deficits. I want to work with a health provider who's going to look at what is the potential. I don't want to be seen as what's missing. And I'm going to share my story with you. It's 6:17. So if anybody needs to, log off, I totally understand. I appreciate that you're here. Appreciate and value that you waited, for us to be here 10 minutes in and late. But I'm going to share this story with you because I find that it's very powerful. And even I grew up in a chiropractic home, and it took this as an adult being diagnosed with MS, confined in my bed for weeks at a time, slurred speech, double vision, for me to understand the power of chiropractic care. So Martin Luther King Day, 8 years ago, I walked into the office and Amanda thought or looked to be like I was on cocktails because I was, staggering and, just not totally in control of my body. I had woken up 10 days before that with numbness and tingling in the left side of my mouth, and slowly over that time frame, it expanded to the left side of my body. I had slurred speech, double vision, and lost function of the left side of my body. My husband showed up on Martin Luther King Day over the noon hour to take me to the hospital to rule out an aggressive brain tumor or stroke or potentially neurological condition. They scanned my brain, did an MRI, CT, did blood work, and they basically came back saying, you have MS. There's a lesion in your right midbrain. And where it was in my brain was impacting the opposite side of my body. So we're going to send you to a neurologist. We want to keep you overnight to run all these tests. And, we'll do what we can. Well, if you know me, you know that number one, a hospital is not a place to express higher level of health. So there's no way I was staying in that hospital room. Number two, I said, call my chiropractor, I'm getting adjusted, period. Says my husband took me to the chiropractor from the emergency room with this new diagnosis of MS where I can barely talk and walk and move. And he took me to the chiropractor to get adjusted. He adjusted me, my speech improved by 50% immediately. They said, oh, we can understand what she's saying. And from that moment, that started a journey of who can be on my healthcare team? What can I do to change how my body is responding to its environment? How can I create a higher expression of health? How can I support my body in a way that supports recovery and healing? So I went to the neurologist and they said, these are your options. You have MS. We're going to send you off for a spinal tap, because that's the definitive diagnosis for MS. If you have inflammatory markers within your spinal fluid, then you have MS. In the meantime, I was doing everything I could think of to support a higher level of health. I was getting adjusted every day. I did acupuncture. I did life coaching. I did tons of reading around MS and Wall's protocol and what are the things to do nutritionally to take away the inflammation on my body. And it took 6 weeks for me to start noticing changes, that what I was doing was working. I mean, of course, when I was going to the chiropractor, he was assessing me visit by visit, saying, okay, we're seeing change. But it took 6 weeks. It's confined to my bed. Husband had to get me dressed in the morning, had to, feed me. And then slowly, I started getting better. Spinal tap came back negative. I'm considered a medical miracle. 12 weeks around, I'm totally recovered. And so this I'm sharing with you because if I was stuck in that pathogenic model, if you know anything about MS, you are destined to be in a wheelchair by 50, 60 years old. My husband signed on to being married to a person where he would be a lifetime caregiver. I probably wouldn't have my daughter right now. I'd be on medication after medication. That doesn't work. Here's another one. That life, that lens, that what could have been is so scary. That's what drives me, because I knew more than what most people don't. And I said, no, I am in a salutogenic model. That is my lens. What can I do to support a higher expression of health? And that's what I did. And so when they say you're a medical miracle, I say, well, in your eyes, I am, because your care and treatment would not have worked. I don't want to be in a box. I don't want to be defined by a diagnosis. That is not who I am. And there's tons of stories out there sharing similar things. I'm a medical miracle because people found another way to support a different expression of health. And yes, there are people who have done all those things and they still have the ailments. I'm not saying that. But I'm saying who you go to for healthcare is going to certainly color your lens and your experience of if you're in fear with how you understand and support and love your body, or if you are empowered in how you understand and love and support your body. They say in cancer, like the biggest thing is if you believe you will survive. Do you believe you're a survivor? That's the number one thing in terms of your odds of survival. If you believe that, then that's the first big major step. So I'm telling you right now, what is your belief system around your body? And who do you go to for support? Do they empower you? Do they support you? Do they challenge you? Or are they just really looking at you in terms of what's the deficit and how do we address the deficit, and you feel good and we took away the pain, you know? Yes, maybe you should manage your weight, but we don't talk about that stuff. You need to demand more. So thank you for being with me. I appreciate all of you. And know that I am really just honored to be a part of your healthcare. Honored that you have included Monarch Family Chiropractic as a part of your healthcare team, and that you show up on these Tuesday nights. And I hope that it holds you accountable to doing something that is the most right for your health, and that it sets you on a trajectory so that you can experience more, life-enhancing, activities, better connection in your body, not just now, but 20 years from now, and that it's happening with you and your family and community. So that's why we ask you to share what you know. And so for all of those who found us through a Patient Appreciation Week or found us through somebody we are so grateful. So I would love to hear your takeaways. Bring them into the office. Thanks for staying with me. You can never end on time. I always got to take my 30 minutes. But know that I so value and appreciate you being a part of our community. So we'll see you guys in the office. Happy New Year. And yes, Mama Z, happy New Year. And we'll see you guys